What we're trying to do as a company is offer the best possible care available to children who have disabilities.
And out we go. And here we have a beautiful, beautiful mold.
We're practicing in Arizona as orthotists, and we're frustrated with having to make cookie cutter orthotics for people and having to use central fabrication for all of the devices that we had to fit. So the beauty of being on our own is that we can cast the patient, modify our own cast, fabricate the device ourselves, and by fabricating it ourselves we can make it any design we want. We can customize it in any way that we want to, and then fit it ourselves so that the patient has more continuity, so that they get better care, so that they have a better fitting, better functioning device.
One of the things I like best about working with orthotic specialists is that the same orthotist that meets with the kids, casts the kids, they fabricate the orthotics there on site. We have found the quality to be superb, and we're finding that we have to send the kids back for modifications much less frequently.
Having our own lab on site and being able to take our own cast and then put all of the correction into it that we know the patient is capable of tolerating makes all the difference in the world. If I want to make an extremely unique design in an AFO, I'm there hands-on being able to do it rather than trying to explain to a central fab office what it is that I'm looking for and then getting something back that's totally different than what I had dreamed it would look like.
We're here for the appointment.
All righty. Mr. Myers, I just have some paperwork for you to fill out.
When the kids get here, the parents fill out the paperwork and they blast in here to the playroom. We can have fun with them. They're not frightened when they come. When we are taking a mold of their leg, which is probably one of the most important things that we can do, a very excellent mold leads to a very excellent brace. So if we have a relaxed child who's been ripping around in here having some fun, it's a much better experience for the child, and it results in a much better device.
Children develop orthopedic deformities because of growth, and so the thing that is extremely important in our practice in managing these children is constant follow-up and making sure that the orthopedic device that we fit them with actually provides a biomechanical realignment of, what we're looking for is a functional outcome, so that we can prevent further surgery, so that we can prevent contracture formation, so that we get them up and walking comfortably without calluses and ulcers and all these things that can happen with a poorly fitted device.
Let's see how this one's doing. You look fabulous.
And then to monitor these kids to make sure that when they grow, the device is adjusted appropriately to make sure that it continues to provide that functional outcome.
Should hold it.
That should do it. The work is unbelievable. I have had other foot orthotics made, hand braces made that didn't fit, which makes repeated times of coming back. That is so valuable to us as parents to be able to just come back maybe 1 or 2 times, get it adjusted, and be on your way and be able to know that that orthotic is going to be good for probably a year at least.
I also really appreciate the pediatric medical background that the orthotist orthotic specialists have. They have a wonderful understanding of many of the other medical issues that these kids have to deal with in their day-to-day lives.
And look at those big splints. And look at those medium splints.
We both worked for the Children's Hospital in Calgary, and Barb, prior to that, worked for a Children's Hospital in Victoria, so we have lots of hands-on pediatric experience.
She understands the different disabilities extremely well, and just like with CP, there are a lot of sensory issues and that kind of thing, so having a real understanding for that and appreciating that makes all the difference in the world.
With our devices, we try to make them look less medical.
Isn't that cool? You want to have a look through those?
And we want the kids to rise up from possibly having children looking at their device and wondering why they need to wear it. We would rather other children look at their device and go, oh, how cool, I want one of those too, and they completely forget that their new friend has the need for any device.
I like this one because it's my favorite color.
There's nothing as rewarding as seeing you know, a child walk for the first time in their new AFOs and smile about it and be happy. Or to make a new set of AFOs for somebody that's picked a special transfer paper or a plastic or something and see their whole face light up when they actually get something that they want rather than something that they have to have.
Green?
Yeah.
Yeah, green?
Yeah.
Maybe like Kermit?
We're doing what we think should be done. And we're treating patients in our facility the way that we would prefer to have ourselves or our children treated in somebody else's facility.